The ABC 10 vaccine team stands for you, and in a major step forward to protect children from COVID-19, Pfizer just announced its 3-dose vaccine is strong and effective against the virus for children who are younger than 5. So let's bring in ABC 10's Lena Howland. She's in studio this morning. Lena, what do parents need to know about this morning?
Bria, if this does get FDA approval, we could see shots in arms for this age group as early as the end of June after the next advisory committee meeting. Pfizer says for children 6 months to 5 years old, its 3-shot vaccine is 80% effective against symptomatic COVID-19. It's also just a tenth of the dose for those 12 years old and older. This comes as new COVID-19 cases are up across the country. For children, more than 107,000 tested positive for COVID last week, the highest since February. ABC 10 medical expert and owner of Pucci's Pharmacy in Sacramento, Dr. Clint Hopkins, says the demand for this vaccine is high as he's been inundated with questions from parents anxious to see this become available.
We know that COVID still exists out there and that vaccination remains the most effective tool at preventing COVID illness, long-term complications, and death. So those parents that are, wanting to get their kids protected so that they can go to school, go to preschool, and carry on with normal life, it's very important to them. So we see quite a few parents asking about it.
I know many parents of children under 5 that are just really drained and exhausted and feel alone in this process of having to determine what is safe for their family.
And that was Megan Dunphy-Daly, a parent of 2 that has both of her kids enrolled in the Pfizer trial right now. The FDA is also considering Moderna's vaccine for kids under 6 years old as well. For now, Moderna is still testing a 3rd shot after data showed 2 shots for kids under 6 had an efficacy rate of just 51% or less. Bria?
So, Lena, if this did get FDA approval, you and I could just go to a local pharmacy and get a vaccine or a booster. But how would this work for children?
Well, Bria, it's a bit of a similar story for this age group. Dr. Hopkins added that kids 3 years old and up can go to a local pharmacy such as a CVS to get these vaccines when they become available with their parents, of course, rather than going to their pediatrician, something he says is very likely to improve access and speed up the process for families across the state.
Something I know a lot of families have been waiting on information about. Lena, I think they'll be excited to see this report. Thank you.